Hi, my name is Heather Walters, and my transcultural nursing presentation is on the nursing care of the Hispanic and Latino culture. Many people use the terms Latino and Hispanic interchangeably, although they do have different meanings. Hispanics in the U.S. are described as any person of Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish culture, regardless of their race, and Latinos are described as people of Latin American descent. Either one, Latinos or Hispanics, they are the largest and fastest growing minority group in the U.S. today, and this is likely due to recent immigration trends, which has contributed to the large U.S. Latino Hispanic population. The dominant language spoken within this culture is Spanish, although there are numerous different dialects and variations, and a combination of English and Spanish is commonly spoken among the youth. It's very important to display respect when communicating verbally and non-verbally, especially with the older population of Hispanics. Respect is critical here in order to build a rapport and create a trusting relationship. Without a trained interpreter, healthcare professionals will be unable to provide quality healthcare. Patients are at risk of improper treatment and will be less likely to return for follow-up care if they are not communicated with adequately, meaning, not using a trained interpreter. Signals can get crossed there. It's important not to use friends or family members as an interpreter, as the patient may not feel comfortable providing all the necessary information to the healthcare professional. Educational materials should be readily available in Spanish, and it's important to remember to avoid gestures that may have a negative connotation to this different culture than it does to the American culture. Religion is very important to the Latin and Hispanic culture, and Roman Catholicism is the dominant religion. They pray to certain Catholic saints for different health-related purposes. An example of this would be praying to Saint Joseph for the dying. Baptism of infants is very important, especially if they are ill. And it is important for healthcare professionals to anticipate that there will be priests and church members, as well as family and friends, that will gather in during times of life-threatening situations. Latinos and Hispanics place a major focus on extended family, grandparents, parents, children. They may all live in the same household together. It's very common. Individuals tend to place the needs of their family members above their own. And the father or oldest male is considered head of household, and he will likely be the one to make all of the healthcare decisions, although extended family involvement will still, take place in healthcare decisions, but it's likely to be the male that will make the final decision. The men are the providers and are considered to be in charge, while the women are expected to be respectful and submissive toward their husbands. Some men, unfortunately, may abuse this power within the family, which could lead to physical violence. Physical violence within this culture is not uncommon, although I did read that it does go underreported, unfortunately. Diet mostly consists of rice and beans and tortillas or bread. Rice and beans are usually prepared with lard, which is important to note because of such a high fat content and increased risk for heart disease there. And simple carbohydrates like tortillas and bread are usually served with every meal. That's also very unhealthy. And fast food consumption is very high among Hispanics and Latinos that live in the United States. So it's important to take all of this into account when providing these patients with healthy eating habits and try to provide them with healthier options than they may be accustomed to. Socioeconomic status is comparable to that of African Americans, but it is much lower than that of non-Hispanic whites. And a low socioeconomic status is associated with unhealthy behaviors and lifestyle, such as smoking cigarettes, being overweight, and being physically inactive. All of that is more common among people with a lower socioeconomic status. Illiteracy is common for those of lower socioeconomic status as well. Many Hispanics believe in something called fatalicism, which is the idea that illness is God's will or divine punishment for sin. This belief has an impact on compliance with both prevention and treatment measures because the patient may view their health as out of their own control. Physical or mental illness may be attributed to imbalances between the person and their environment. For example, illnesses may be caused by being too hot or too cold. An example of a cold disease could be menstrual cramps, rhinitis, pneumonia, or colic. Examples of hot diseases are pregnancy, hypertension, diabetes, and acid indigestion. And treatment for these would be, a cold disease should be treated with a hot substance and hot disease treated with a cold substance. Some patients may prefer to use home remedies and folk healers instead of Western medicine. Magico-religious practices are very common, especially during times of serious illness and disease. And these practices may involve shrines, medals, candles, prayers, and healers. An example of a traditional healer in the Mexican-American culture is known as a curandera, which focuses on the physical, mental, spiritual, and social aspects of a sick person. A curandera may be consulted prior to or concurrent with a professional health care. Many Hispanics are reluctant to share their personal health beliefs with healthcare professionals, so it is important to, really assess these questions. And while some prefer home remedies and folk healers, many Hispanics and Latinos still utilize Western medicine or a combination of traditional and Western medicines. There are some barriers to healthcare, of course. Latinos and Hispanics are such a diverse group of people, and some of these barriers to healthcare include language, of course, illiteracy, lack of health insurance, different cultural beliefs, possible illegal immigration, and mistrust. And unfortunately, many Hispanic and Latino children are raised to view European Americans as untrustworthy. So that is a big barrier for Americans to overcome as far as healthcare professionals when interacting with this culture. Hispanics and Latinos have the highest teen pregnancy rate in the country, although there has been a significant decline in these rates since 2007. Studies indicate the decline in teen pregnancy is likely related to adolescents waiting longer to have sexual intercourse and the increased use of contraceptives by teens. Adolescents enrolled in school and after-school activities are also less likely to have or father a baby. And adolescents with mothers who had a teen pregnancy and lack a college education are more likely to have a baby before age 20. Unfortunately, there is a large tendency to seek late prenatal care or to have no prenatal care at all and not be seen until their actual delivery. The extended family here also plays a large influence in pregnancy and childbirth. Childbearing is primarily women's responsibility. Hispanic and Latino family members are often very protective toward their children. They have a very warm, loving home with regards to childbearing. And older children are held responsible to help raise the younger children. When a girl turns 14 years old, she has what's called a quinceañera celebration. The quinceañera signals the woman is moving from childhood to becoming a woman and that she is available for marriage. The young woman is allowed to drink alcohol at the celebration, although she is underage, especially in the United States. Another big symbolic event here is that she cradles a baby doll, signifying her last baby doll, and more importantly, this shows her new capacity to be a mother. In my opinion, this might be, related to the increased rate of teen pregnancy here, because at 14 they believe that they are now ready to be a mother. The extended family is very involved in caring for a dying family member. Autopsies and organ donations are typically refused, especially among Catholics. And public expression of grief is common, especially among women. So it is important to be aware of this and to allow this grief and to be aware that, this culture may be very loud and crying if someone passes away. And it may be best so that they do not disturb others to try to gather the whole family into a public place or into a private place, to allow them to express their grief, although they may not leave the individual side who has passed away, and that is understandable too. And anointing of the sick by a priest is a rite of passage and a requirement in life-threatening situations for Catholics as well. In summary, respect and trust is a big topic here. It's crucial for developing a rapport and a positive relationship between the nurse or provider and the Hispanic and Latino patient so that they feel comfortable enough opening up to you. And it is critical for nurses to be culturally aware of the health beliefs and practices and needs of this culture so that they can provide optimal care. Thank you.